le TSAT Brian.
Yeah.
Live stream has started.
Yeah.
Thank you. That's great. So welcome everyone to the May meeting of the Toronto Seniors Housing Corporation Quality and Tenant Engagement Committee. Just in case you didn't know where you were, that's where you are, and we're glad that you joined us. My name is Linda Jackson, and I have the pleasure of chairing this committee. I'm just going to start with the land acknowledgement, and then I'll go to give some overview. Do you have the land acknowledgement, Tina, that if we could put it up? Somebody has it. Thank you. Thank you. And I would like to take a moment to do the land acknowledgement. We honor the land that we are on, which has been the site of human activity since time immemorial. It is the traditional territories of the Huron-Wendat, Anishinaabe, and the Chippewa, and the Haudenosaunee Confederacy, and most recently, the Mississaugas of the Credit River First Nation. Ontario is covered by 46 treaties and other agreements, and it is home to many Indigenous nations from across Turtle Island, including the Inuit and the Métis. These treaties and other agreements, including the One Dish with One Spoon Wampum Belt Covenant, are agreements to peaceably share and care for the land and its resources. Other Indigenous nations, Europeans, and newcomers were invited into this covenant in the spirit of respect, peace, and friendship. We are mindful of broken covenants, and we strive to make this right with the land and with each other. We are all treaty people. Many of us came here as settlers, immigrants, newcomers in this generation or generations past. We would also like to acknowledge those who came here forcefully, particularly as a result of the transatlantic slave trade. Therefore, we honor and pay tribute to the ancestors of African origin and descent. Thank you.
Welcome.
And yes, again, good afternoon. And I'm pleased to highlight that at the most recent board meeting of April 27th, the interim strategic directions and the key performance indicators that we reviewed at our last meeting were adopted. And I want to particularly thank Mary and all of the staff members for all their work in getting us to that point. It's very exciting to have that document approved. This is a significant milestone. And I also would like to thank other staff members who worked on it, STAC, and other many stakeholders who contributed. We look forward to updates on the progress as we move forward with this work. Today's agenda is an exciting agenda, like usual. We will review some of the items that we've reviewed previously, the operational performance dashboard, and there's some great updates on that. I know that people will be interested in hearing Tom talk about the end of the listening tour, which is actually just the beginning of more listening, is what I took away from reading it, and the feedback and the insights that came from that tour. We will have a quarterly update from OACH, our Commissioner of Housing and Equity, and an update. What I'm most excited about today is a new agenda item, because people have been asking about this for some time, and that's actually for us to start talking about the programs and partnerships, and that will be a key item of the agenda. We have two deputations, and I know that you'll make sure that I actually remember to bring Bill on for item 9, the listening tour, and item 10, programs and partnerships. Finally, we will at the end of the meeting also consider adding another QTech meeting to our timeline in July. So we'll follow up on that. There's a number of items that we believe we don't want to, that it would be prudent for us to actually address before the fall. The tenant engagement model, the tenant experience survey, our quality improvement follow-up, and policy items, including the use of space and tenant action funds. So I know it's a busy time of the year, but I'm hoping that our board members will be able to come up with a date that works for all of us in July. So we will get to that item as well. So with that, I'm going to move to the approval of the public meeting agenda. Is it easier if we have it up, or we can put the agenda up just for a moment for people to see? So that and I know that people have it in front of them. Is there anything to add to the agenda? Are we okay with the agenda? Approval of the agenda? Thanks. And I've reviewed most of what we have. Is there anything missing?
No.
All right, so we'll consider that the approved. Carrie, can I get you to approve that?
Absolutely. So moved.
And a seconder? Thanks, Fareed. All in favor? Terrific. So that's our agenda. And then we're going to move to see if there's any conflicts of interest. Can I have anyone declare any conflict of interest? Does anyone have a conflict of interest? Hearing none, we'll move on to the next item, which is the approval of the minutes of QTE from March 9th, 2023. Boy, it's 2 months ago. Is there any additions, edits, changes, questions about our minutes from the March meeting? You're making this easy for me. Hearing none, can I have an approval of the minutes of March 9th, 2023?
So moved, Madam Chair. It's Carrie.
Thank you, Carrie. And a seconder, Jim, thanks so much. All in favor? Terrific. All right. Action item. And I really appreciate the efforts that our staff are putting into the action items. Has everyone had a chance to take a look at the action items? Any questions about them? I like the fact that we're moving on things, or we're capturing them, and that we seem to be moving forward. I think there's in progress or completed for all. Any questions? Hearing none, we will move ahead to the first item that is a report back, and that is our CEO update.
Yes, through the chair, thank you, and good afternoon to everyone who's here at our QTE meeting for today. And I think you heard when Linda was just commenting about the perhaps the need for another meeting, because there is a lot of activity. My update is really just filling in some of those covering off of just a few comments on those areas for those topics which we're not addressing in today's meeting. And one of them was the quality improvement projects, which, just a reminder, it's the pest management, safety and security, and staff and tenant relationships. And two of those, group pest control and safety and secure pest management and safety and security, they are complete. And I think the final meeting of the tenants and staff project is coming up. And so our intention, and this kind of relates to kind of the timing of our meetings, would be in June, the beginning of June, to provide an update to the board on those projects, and then at our June meeting, approval of the recommendations that are coming forward from those three quality improvement projects. So that's the path that we plan on moving with those with the quality improvement projects. And then also, I wanted to just take a moment to share with the committee the work regarding STAC, the Seniors Tenant Advisory, because there has been a lot of activity around that area of engagement. We had at our last meeting I think we had a presentation by the city on the Rapid Rehousing Initiative, but there was very good discussion at the meeting regarding the initiative, and then subsequently there was discussion online, and we're going to actually at our next meeting just revisit that again, because it is such an important area around how we support the city in rehousing some of the more, I guess, more challenging individuals, but then subsequently that has an effect on the environment, can have an effect on the environment in the building, and therefore kind of collectively, how do we support those individuals but also support the broader community, the building. And so that's going to be there. We also there's been and we'll be updated at the meeting around use of space and the tenant action fund, as we've heard before. And also there's been interaction with STAC on the tenant engagement model. They've, at the last meeting, we did introduce to that group our three new engagement community services coordinators. And STAC is also meeting tomorrow, and we'll be discussing aspects around the tenancy management process, further follow-up on the tenant engagement model. And then at tomorrow's meeting, also be introducing the STAC group to our communications team. So really taking that opportunity for the leaders of our tenants and within our staff to get to know each other even further. And with the just want to highlight a bit more on the tenant engagement model work because so key to us, and work is definitely underway with Barnes Management Group that was shared with QTE previously, but they have started their consultation and actually has been working with the stack tenant leaders around determining how we best want to kind of engage and get further information around the what the model will look like, and also they're doing the environmental scan and other meetings. So that work is moving along nicely, and then just wanting to mention that and not. We're certainly keeping it on our radar screen, and there's good. We want to make progress around our tenant experience survey for the fall of 2023, and so that is probably and likely for that meeting in the summer, providing more information to this committee on how that tenant experience survey will roll out. And so those are the updates that I wanted to provide this afternoon. Thank you.
Thanks so much, Tom. Any comments, questions? I know some of you are engaged with Stack, and I know that Tom has been taking over connecting as our leader. All right, thank you. And I would concur, Tom, that I think actually having the conversations about our tenants and the environments that we're creating is really important, and it's great that's happening at that forum. So
Thank you.
So I think we're just going to take that as information. We don't have to have an approval on that. And I think we will go to the next agenda item, which is the operational dashboard. And I believe that Brad is going to walk us through that. Over to you, Brad.
Yeah, thanks a lot. I'm going to share out my screen here. So we have the operational dashboard for the ending of March 2023 here to review. The first page here gives us an overview with regards to the arrears collection process and where the different files sit within it. We did have a slight decrease in the arrears for this month, as well as the vacancy rate numbers. And I'm happy to say that we stay well under the 2% that the service managers asked us to remain at. With regards to the work order service levels, they're broken down by region, and you can see a slight uptake as the percentage that are completed within our service level of 2 days for staff ones and 5 days for vendor work orders are completed, as well as a slight uptake as we continue to improve our performance with regards to administrative requests that our staff field from our tenants. Arrears, as I mentioned earlier, there was a slight decrease of just over $1,000. The largest increase we saw in this was as staff continue to enforce the ACP, and it's with a $64,000 increase in the number of arrears that are sitting at the N4 stage. Would like to say that a lot of this, we're looking to continue to improve our performance as relates to arrears, and we're really excited that we have a new information sharing partnership that we've entered into with OACH and the Commissioner of Housing, who you'll hear from later on today. The vacancy rate, slight uptake in the number of units that were vacated over the winter months. This is a seasonal thing that always happens at the conclusion during the months of January and February. The seniors portfolio has always had a bit of a spike when it comes to move-outs. And however, I said we're still below the 2% target at 1.93% at the end of March as an overall vacancy rate. Maintenance work orders, there were 9,400 work orders that were issued through staff and from tenants. The work order performance, again, the blue line down here, you'll notice that staff performance is up to 89% being completed within 2 business days. And we've actually seen an uptake as we continue to get better at managing our vendor, as the vendor's up to 30% within 5 days. Most of them relate to pest control, plumbing, and janitorial, and those are the top drivers from the maintenance area. Pest control, March staff scheduled 1,828 pest treatments. As we've onboarded our environmental health team, we've actually been able to take a deeper dive into that. And I'm pleased to say that 321 units were declared bed bug free and 152 units were declared cockroach free in the month of March. However, we did treat 702 units for bed bugs We've actually been able to, and it was one of the requests of the committee, was to look at the pest treatments by units. And thanks to our new environmental health team, we've been able to break that down. And 40% of the units, 40% of developments have less than 10% of the units requesting service. And we have 3 developments where more than 50% of the units are requesting service. And that's allowed us to then focus our resources into those developments as we continue to use the metrics in order to allocate that. We're going to be piloting a building cleanout in a development that has 66% of the units requesting services, where we're going to hold some building meetings. We're going to have vendors on site. We're going to have our staff on site to support tenants through it. And we're just in the process of redeveloping a communications plan for the tenants and the communication documents for the tenants. And we're hoping to have that off the ground later this month. Administrative requests had a rather large increase in that. Staff completed 2,546 administrative requests, most to do with documentation support and taxes. As we close out the tax season, that one should drop substantially. And you'll notice that the complaints and the unruly behavior is actually down substantially at 4.1% of requests. Community safety unit, there's 779 community safety unit incidents. While this is on the increase, I think it's important to point out that some of these, such as the self-initiated patrols and the meetings that we're asking the community safety unit, these are actually positive things that are being reported as they increase. And we'll look at the development of a future dashboard that'll break this down into a way that'll tell the story a little bit better about the assistance that we receive from the community safety unit at Toronto Community Housing. With that, does anybody have any questions with regards to any of the slides?
Maybe I'll start just on the community safety. So what you're saying, Brad, is that we should expect an increase in the number of incidents. Is this based on increased knowledge about reporting, or can you just actually embellish that a little bit?
Yeah, so with the community safety unit, we've recently met with them, and we're looking at getting value for the money that TSHC provides the community safety unit, and increasing the number of meetings, the number of patrols that the officers do within our communities. And I was just indicating that as the maroon and the green categories start to increase, it's going to appear there's increased incidents. However, that's a positive thing, that we're getting these officers out into our communities and we're having them attend meetings with the tenants. The other thing is, over the summertime, there's a violence reduction program that Toronto Community Housing puts into place. And we have one of our developments at 310 Dundas that actually is a beneficiary of that program. And you'll see a large number of increase. They'll see a large presence increase with the community safety officers, which will lead to increased incidents with the CSU.
Any other questions on the community safety? And then I'll move to anything else. I have a few questions on the vacancy.
Yeah, sorry.
Go ahead, Free.
Yeah, I just kind of, I'm trying to understand as well the community safety incident reporting. And I guess what I'm hearing, and maybe this, I hope this is what I'm hearing, is that the cases seem to be going up because there's increased quote unquote enforcement, increased patrol, rather than, you know, an absolute increase.
Yeah.
Okay. And then on the antisocial behavior piece, also I see that seems to be kind of, you know, taking a fair bit of the pie, and I just wanted to understand that a bit better.
Yeah, so these are responses for staff calling in the community safety unit, for tenants calling the community safety unit. And as we continue to educate and put out the community safety unit's number, we recently entered into a project with them where we're providing magnets and things with tenants at lease signing in order to make sure that they have the right call numbers. We're finding that the call volume is going up, but maybe not. When you look at the incidents, the serious incidents and arson and things like that, that's maintaining relatively flat. It's the TSHC tenants are making better use of the service.
Okay. All right. So this is more increased reporting rather than, you know, rather than an absolute increase necessarily.
Correct.
Okay.
Yeah, we should probably pay attention to it, because I think at some point we should see it either kind of balancing off. But I hear what you're saying, so thanks for that. For that, do you mind putting the vacancy slide up? Don't know if other people had some questions. I just wondered if you could talk a little bit more about the rapid rehousing increasing from 22 to 41.
Yeah, so there's, as the service manager has issued has allocated X number of resources, units for the rapid rehouse program. The rapid rehouse program is a program where the direct placement of residents into vacant units from the shelter system. They come in with support. They come in with a worker and follow-up supports that are in place, as well as TSHC staff, the shelter worker, and the support agency form an sort of onboarding tenancy management plan for the first 3 months in order to keep an eye on and sort of ensure that the tenants are receiving the supports that they need in order to transition from the shelter system into independent living. And that allocation will continue to rise throughout the year as far as units that are allocated to them. The issue is that the vacancies, we're looking for seniors that are A, currently in the shelter system, and B, have a higher level of acuity with regards to being ready to live independently than others. So those units, as they're allocated, are staying open for a bit of a longer period of time. And that's why you're seeing the uptake in it, because we're not just placing anybody from the system into it. We're ensuring that people who have a chance of having a successful tenancy and transitioning from homelessness to home are placed there. And if it means that we have to wait a little while in order to find the right applicant, then the service manager and TSHC maintain the units vacant for that.
Great, thank you for explaining that that increase. Looks like the numbers are going in the right direction in terms of the vacancy rate. Really pleased to see that. That was something that we'll remember that was much higher when we started as a board. Close to a year ago. And it's really nice to see that, because that's, when you think about the state of housing in Toronto, it was really a shame to see that there were vacant apartments and they weren't going to needy folks. Carrie?
Thank you, Linda, and Brad, thanks for that great information as always. Just returning to the rapid rehousing program. And you said that there is support provided for the tenants who are relocated for about a 3-month plan, and it's a good umbrella, a good comprehensive support. Is that solid? I realized today, talking about money and asking if anything is solid or going to be around is, almost a ridiculous comment, but I so recall earlier in the year when we were first talking, when Paul Johnson, in his former role, was coming to our meetings and said, that while supportive housing was being encouraged, there really wasn't money for the supportive housing. So are we okay there for at least the time being?
Yeah, that's a great question. So we actually had a meeting this afternoon, and we're constantly working with the city in order to revise and ensure that the follow-ups are in place. They're in place for longer than 3 months, Carrie. What it is that there's a 3-month check-in where we go into the unit and we check in with the tenant, we check in with the workers, and there's a formal meeting at that point.
Okay.
With regards to the supports that are in place, every rapid rehouse client that comes in from the city is assigned a support worker. And the conversation today actually centered around how we performance manage the support worker and the support agencies that the city is assigning, and they're committed to providing the support workers and working through us with any problem. Any issue that we've had with any support worker or agency that's come up, the city's been more than happy, and they've been really quick to actually remove that worker and have a new one put in place in order to ensure that the tenant receives the right level of service that they should.
Okay. Yeah, it's a big task. It really is. So
yeah, and they've been a really great partner for us as far as working the kinks out of the system, so to speak. The rapid rehouse program, as it was originally designed, isn't what we implement today, and it'll continue to be tweaked to ensure that we have successful outcomes.
Yeah, great. Thanks very much.
Tom, did you want to join in? Oh, you're on mute.
Yeah, through the chair. Sorry about that. No, I think
That's
Brad
okay,
just
no worries.
hit on so many of the high points, but I just wanted to confirm that, for the meetings that I participate on with the city and the housing secretary, city manager, Toronto Community Housing, there is definitely the support, and they have the city, has a very vested interest in ensuring the success on this work. So that certainly, from my experience, and I think as Brad is saying, the city has been responsive, to our work in this area. So we want to, though it is really important that we keep this one on the radar screen. And as I said earlier, we do have to be, continue to be kind of thoughtful and act on what, when there are issues in our buildings, in our communities, how do we support that as well? So we do keep talking to the city about that as well.
Great, great. And I'd be interested at some point to have an understanding of what does success look like,
Yes.
and by whose definition. And maybe that's something that over time we could actually, capture for, because I personally think it's wonderful that we're actually supporting seniors to move out of shelters, or seniors shouldn't be in shelters. But it would be great to know from their perspective what success looks like.
Through the chair. So we actually could provide that information at our next QT, because the city is they have been indicating like what they determine those success numbers to be, and what that is defined as. So that, Brad, we should just keep that as something additional to show, because that was the type of information we're sharing with STAC.
Thanks, Tom. Jim, do you want to jump in?
Yeah, I just wanted to say that I had some good discussions with tenants, with some of the people from STAC over this rapid housing, and tried to let them know that this isn't an approach that we're going from the past. It's something that we're working on to make sure that the supports are there for people, so that those and that the city has learned over the years from agencies and from just experience the things that are needed. And I just tried to confirm with those people who were pushing back against the rapid housing because of fear of harm reduction and substance use. So I shared with a couple of people. I shared the city's harm reduction orders to all their agencies to adopt a harm reduction approach, and that in doing that, the whole idea for harm reduction is to reduce not only the harm to the person who's using, but the community in which they live, and we're going to be working hard towards making that successful. And I'm really glad to hear what Brad had to say about this. Thank you.
Thanks, Jim. And I want to thank you as well. I found your comments particularly helpful. And I really appreciate your voice and your guidance on the board in this matter. So thanks a lot, Jim.
I think one other thing that I could say is that what we're looking at doing, some of the successes that we've realized from the Rapid Rehouse program, the 3-month check-in and kind of ensuring that tenants feel safe and comfortable in their home, is something that we're actually looking at expanding out to other tenants. And the Rapid Rehouse programs kind of taught us a lot of things about the way that we onboard tenants and how to ensure successful tenancies that we can take and use in the greater portfolio as well. So it's been a really great program so far.
That's great. Thanks, Brad. That's very helpful. Any other comments about the our operational dashboard? We're heading in the right direction on many of these metrics, and I'm not, for one, not taking that for granted, because I haven't always seen that kind of progress. So thank you very much. It takes a lot of work to actually be paying attention to these areas that are important, and we will keep track of the safety incidents and see how that actually progresses over time. But thank you, and the presentation, the way you're presenting it is helpful as well. So with that, I think that is also an item for information, so we don't have to have a formal approval. We're going to move on to another key item, and that is the summary of the listening tour from Tom. Oh, we're not hearing you, Tom, but I think we're getting some background. Oh, and yeah, I think we do actually have a deputation here, don't we? Do we have a deputation first? Sorry, see, you weren't meant to speak first. I told you guys, you have to hold me accountable for this. It's probably the deputation line. Is that you, Bill?
That's me.
You'd think I'd figure this out by now, eh? Thank you, and welcome, Bill.
I was thank you. I was asking Matthew if I'm sort of an ex officio member of this committee because I'm the one that always shows up.
I think you are.
Good afternoon, Madam Chair, and Quality and Tenant Engagement Committee members. Thank you for this opportunity to address the committee today. My name is Bill Lohman. I want to comment about the listening tour. I think CEO Tom Hunter did an impressive job to meet and greet leadership with the listening tour, to introduce himself, usher in the new corporation, and set a tone of listening about hearing about the issues and understanding the dynamics in the 83 senior buildings. It's notable. And it, you can see it generated a considerable list of learnings to support the priorities and the focus for improvements going forward. And I think over the past year, we saw an impressive effort to integrate and implement the elements of the integrated service model into the framework. Some simply and easily, and some not quite so much. But the past year also saw, as was mentioned earlier, the Health Commons report, Joy Conley's report on principles and methods. We had the QIPs. We're now we're involved in the use of space in the TAF consultations, and that's nearing completion. And now BMG is just beginning to start the comprehensive tenant engagement framework. So there's a lot going on, and there's a lot to draw on, in these reports, where we can work with tenants to help translate these priorities, into some changes in policies and programming that will sort of accommodate everybody's interest and needs. And I wanted to, I wasn't going to speak on it. Well, actually I was, but then decided not to. And then after listening to Tom speak, I wanted to reiterate the importance of the inclusion of people, with complex needs and the rapid rehousing. I was, part of that consultation, and I was really impressed with the successes that the program has seen, and any outbursts that come out of that, I think, are individual and really don't represent the program itself. But I think that it's that habit that when somebody new comes in and something happens, well, the assumption is to blame it on the new person. And so I think that there's, as a mention of needing to balance the inclusion of people, and with the community itself, so that to help encourage somebody's sense of feeling welcome, and hopefully that's something that we can do through the tenant engagement model. But I hope that that there is further discussion, and that in that discussion that there that the considerations of how any potential episodes that affect a community's balance, how we can address those things. So aside from that, I mean, I just want to point out that, and I'm going to say it again, we're still waiting for our tenant engagement and being connected to our neighbors. I know that's in the process, but I guess it's just me having to reiterate and drum that in. But I think all in all, that we're hoping for some deeper understanding about the definition and the scope of what is taking place, so that tenants have a better understanding of what the bigger picture is that's taking place, to help them better understand the changes that are taking place inside their communities. So thank you very much.
Thanks, Bill, and we'll be back to you on the next item as well. If there aren't any questions for Bill, I'm thinking that maybe Tom, you could address some of the things that have come up with in Bill's comments in your report.
Yes, through the chair. I think that with the listening tour, some of that I think will certainly get picked up. But I am on this one. You know, I think I've spoken to it several times at QT or at the board, and I think Wendy has really prepared a bit of the kind of the wrap up information around the listening tour. So I'm going to start by handing it over to Wendy Dobson.
Thanks, Tom. Through the chair. Yeah, just wanted to bring up a few highlights on the report. First, I want to say, as of May 1st, Tom had visited 72 buildings and visited with 2,300 tenants, over 2,300 tenants. And we had 65 interpreters that we brought into those meetings as well. As of the end of this week, he will have visited with tenants from all buildings. He wasn't able to attend 10 of the buildings due to construction and other issues. One of them is Flemington, that has 8 buildings in one location and is in a reconstruction mode. And yeah, we wanted to make sure they were all included. So we found alternate locations to hold those meetings. So those will be finished this week. So we will be officially finished finished at the end of this week. I wanted to also add to that this is actually not the end of the tour. It's the end of the listening tour, but now we're starting with the connecting, with tenants connecting with the CEO tour. So it's the connecting tour. So it will just be a little less ferocious of a pace. Just so Tom can balance his workload, but still stay connected with everybody. So so the plan is approximately 1 building per week is what we're hoping for, wherever his schedule allows, and we'll be going in approximately the same order of buildings, so that people are waiting. You know, that the pace is approximately the same of when he returns to each of the buildings, to be fair. So so that is the plan. And I also want to mention we had 147, so staff attend 8 events as well, which was the majority of those were our frontline building staff. And a lot of our staff also participated in the interim strategic direction. So we did get to hear from them in several places, which is great. And what I really liked is that if you look at the recommendations from both sides, from tenants and staff, there is alignment on pretty much everything. And you know, I think that really shows how the corporation and tenants are aligned and where we want to see this corporation go and what we want to achieve. So I would agree with, you know, sorry, my brain in a mask, it gets hot and hot and a little off. Just the idea of how much this listening tour, you know, it led to the creation of the QIPs, the listening tour, all of the reports that Bill had mentioned, all went in to inform the interim strategic directions, as well as input from tenants in other places. You know, we'll be continuing on even after we finish the tenant action funds and use of space policy to consult with tenants on those. You know, I don't think this is probably the end of quality improvement projects. we're doing lessons learned so that we can learn how to do this even better moving forward. And so I think it's great to see this project come to an end, but to lead to all these other wonderful things, and that we're not stopping. That I think the priority for Tom and sorry, Tom, I'm speaking for you, but and the organization is that we continue to prioritize the tenant voice and the staff voice as well at the table to make sure we're all working as one giant team to meet the objectives. And now we have the interim strategic directions to guide us there. Any questions about anything in the report?
Thanks, Wendy. Carrie.
Thank you. Thank you, Linda. Thanks, Wendy. No question, just a comment. You mentioned the number of areas where staff and tenants are in agreement. And I think it's particularly important that one of those areas is building meetings, where tenants can be informed about a number of issues that are taking up a ton of staff time, and just to keep that communication going, because as tenants have said a million times, the face-to-face is the most important, is the preferred method of communication. And if they can get together in building meetings with, perhaps some regional representation as well, it's just going to make sure everyone's on the same page going forward. So it was really important to see that. So thank you.
Yeah, through the chair, Brad can also possibly provide some updates on those building meetings that are actually, I think, now a requirement for the teams. But I know they're also very excited about them and happy to be doing them.
More meetings.
Yeah.
Yeah, through the chair, just each of the regional managers will be required to host one building meeting within each building per year. We've developed a slide deck, held 4 of the meetings, and have taken a break from them in order to review the slide deck, the tenant participation, and the feedback. And then we'll be putting together, working with the comms team to develop a new deck that the managers and their staff will take out in order to ensure that they're front and forward facing for their tenants and well attended.
Great.
That's great. And maybe there's a way that we can capture that to ensure that they're happening. I think the other thing that's important to me is that it's great. The initial engagement is important. And, it sounds like the messages were uniform. Or somewhat consistent from building to building. I think what's going to help us to actually be even more credible is that people feel like there's actions that have been taken from the feedback that we've received. And although I think we're getting that feedback at the board level, finding a way to actually feed that back to our tenants will be really important. When people give time and their effort and their opinions, I think that's a really important part of the engagement.
Through the chair, I completely agree. And I think, the quality improvement projects, I think, are one of the biggest things that have come out of that. And I think our communication about our actions that are coming out of that will be a key follow-up on the listening tour, not just the quality improvement projects. Yeah, to demonstrate your voice was heard, we're taking action. Yeah.
Exactly. Well, thank you. It takes a whole village to actually get a CEO to all of those buildings. And it's amazing that here we are. I didn't really think you'd be able to do it in a year. And so hopefully we will get to those few stragglers for very good reasons that we couldn't get to, but and that we'll continue to listen, and that our board will listen too in terms of this process. So thank you, Wendy. Thank you, Tom, and thank you to everyone who has been out to so many of the buildings. I think that one is also an item for information. I don't think that we're getting an approval on that one. So that report. Did you want to add something, Jim? Or was that a clap? That was a clap. It's hard for me. It's hard for me to tell the difference, right? But I agree. That requires a standing ovation, I would say. So thank you. And I think before we go on to the next item, which actually has, Fareed, go ahead.
No, sorry, there was supposed to be a clap as well.
Okay, yeah, you know what? I think the hands are floating a little slower. Did you notice that? It's like, yeah, so thank you. I like those claps. And actually, this is really timely that our next item, and I know we have a deputation before Japri starts, but I think that this is timely as well because what we heard on a lot of these listening tours is actually the importance of programs and partnerships in our buildings. So we're going to be talking about that. But I think we first actually have a deputation. I think it's over to you, Bill. Are you there?
I am. Thank you, Madam Chair. I didn't write anything down for this. This is a this is a rather near and dear, and it's confusing at the same time. I'm in one of the communities that has been involved in some of this preliminary work that's that's on display here. We were working with the Red Cross, and honestly, I have to say that not until I actually got to see this list that was put together here, was I aware of how busy and how much effort has gone into setting up all of these partnerships and trying to keep track of them all. And I guess I want to speak to the work that we're doing in my community, and that is it's been rewarding. It's been a lot of hard work in some instances, trying to pull together these ideas to frame some community engagement. But I think it's something also that I've been kind of spouting about for some years, the need for this kind of a roundtable for communication. And I think for the most part, we have established that. As a matter of fact, we have a full meeting on Thursday. And we've done well with Baycrest and setting up those programs. We now have a nurse. We have our regional care coordinator was at our last working group roundtable meeting. And so things are slowly starting to come together. There are some issues, and I was speaking with my partner, Olga, and that is that, realizing that throughout this process for the last 9-10 months that we've been engaged with the roundtable idea, there were continual conversations going on that did not include us amongst other agencies and housing staff, which really kind of dilutes the idea about it being a roundtable where we're, as somebody mentioned earlier, one big giant team. It basically shows up as a system that is run by one person because everybody needs answers from that one person. And the tenant leaders are just kind of left sitting there, picking up pieces and trying to do work that sometimes is being countermanded. And so, I mean, there's really some question about the actual involvement that the senior leaders have. And when we look at the way this model is being framed, it raises questions about what are we really here for? We've helped provide ideas and solutions, and where is the support coming back, or even the acknowledgement? At a previous meeting, I mentioned something about volunteers. And how many volunteers has housing acknowledged? Well, this is an example of some tenants, and then there's a whole list of other tenants who have been involved in helping to make these things happen. And they're not even being acknowledged or recognized at their building levels. because the new policy are showing that they're open to everybody for funding or for this or for that. And it raises real questions about how is anybody supposed to have a tenant engagement around a system that doesn't appreciate their tenant leaders. And there are some questions about accountability and promises made repeatedly and promised and not fulfilled. So that leaves me with some real serious considerations about my involvement and my worth. That's all I have to say on this subject for today. Thank you very much.
Thank you, Bill. You've given us some food for thought. I'm going to pass it over to Dupree at this point. And if you want to introduce yourself, I know you, but I don't know if everyone does. And it's lovely to see you. Tom, did you want to comment first?
Yeah, through the chair. Yeah, thanks, Linda. And I'll also do the introduction with Jay Preet here, our manager of access and support. And Jay Preet is agreed, and we're glad that he's going to provide some more of the focused information for the committee and then subsequently to the board on partnerships. And I would like to, kind of an overall comment with where we have been and where we are, with our partnerships. Because we in this area, in this space where Jay Preet has been working around kind of the tenant engagement and partnerships. There's the tenant engagement aspect. We talked about the tenant action fund, use of space, and so there's that area where Jay Preet has been working the tenant engagement model. But what we wanted to focus on today in this presentation is the aspects around kind of the partnerships and the programs. And Jay Preet has done with the transition Toronto Seniors Housing, Jay Preet has done really a phenomenal job, working in the partnership, as I said, the partnership space. And though, and the resources have been being built and focused in this area over the year. And it was only towards the end of last year and into this year that the community support coordinators, community services coordinators were put into place. And you'll see in this presentation that, it has been evolving over the past year. We a lot of the work, behind the scenes was just even getting kind of agreements in place with some of these partners. And so I think it is, we're coming to terms and understand that we didn't achieve as much in the area of partnerships as we had, let's say, in terms of some of the other work. And we'll just use even vacancy kind of as an example, where we kind of accelerated those areas. It's time now that we really turn more attention to this aspect of the partnerships. And with the director of engagement, partnership, and communication now in place, and you'll see that Jay Preet has more of the team in place. So much of the good work that is there is what we now want to expand. And so that's what we want to share with you today. What are some of those real positive areas of our partnerships, but also I think the incredible potential for growth. And when we look at this, resource constraints within our system, across whether it's the shelter system, housing, health, wellness, it will be these partnerships that will enable us to bring in, I think, more quantum elements of support to our tenants. And partners like Baycrest are willing to do that. And so there's a lot that's really starting to spin in this space. So with that kind of overall comments, Jay Preet is our manager of access and support, is going to provide you some more detail. And we really hope that today's presentation you'll be asking kind of some questions or for information to understand this as best you can. So Jay Preet, thanks.
Thank you, Tom. Good afternoon, everyone. Can you hear me?
Yes.
Great. Let me share the presentation. Can you see the slide? Okay, let me begin. Thank you again. Good afternoon, Madam Chair and committee members. I would like to take this opportunity to share with you our community development efforts to date with a focus on our partnerships and programs work as reflected in our report to the Quality and Tenant Engagement Committee. Since transitioning to the new corporation, we have been focused on renewing and establishing new partnership agreements to revitalize community programming that has been on pause for 2 years due to COVID-19 restrictions. Programs and partnership development is a key to achieving TSHC's interim strategic objectives, as these programs and partnerships enable tenants to access on-site health and social supports that also foster stable tenancies, enhance tenant engagement, and facilitate access to programs and services that align to tenant needs. Based on our last tenant experience survey, 75% of our respondents expressed a need for staff to help them access programs and services, with tenants requesting programs to be delivered in languages reflective of our tenant population. Tenants requested access to on-site health and social support services, along with access to in-home services, including personal support workers, homemakers, and food security programs in order to support tenants to age in place. In order to better support community development, tenants requested access to community gardens, learning opportunities such as health education and language classes, as well as opportunities for social gatherings and forums to provide tenant input and to connect with site staff. We have completed our integrated service model staffing complement by hiring 4 community services coordinators, in addition to our current senior services coordinators, building maintenance, and administrative staff. As a result, we are better positioned to identifying tenants' community needs, developing and evaluating programs and partnerships, and fostering tenant engagement across our 4 regions. The majority of our buildings are well equipped with large recreation rooms, community kitchens, and other common amenities that we are utilizing to develop tenant and agency-led partnerships to meet tenant community needs. Our new community development team consists of our communications and engagement director, 1 manager, 4 community service coordinators, 1 business planner, and 2 clerks. As a result of our enhanced staffing and access to common amenities, TSHC is well positioned over the coming year to enhance its range of tenant-related programming and supports, improve integration of regional health and community services, and provide opportunities for tenant leadership and engagement. This will enable TSHC tenants to age in place in comfort and dignity, with access to programs and services, and with a voice in their community. So the following slides will provide you with an overview of our current programs, partnerships, and activities. Our current programs and partnerships consist of 126 reoccurring community programs, and these represent 45 partner agencies and 19 tenant-led programs. We also have 33 supportive housing partnerships and 45 referral and head lease partnerships, where eligible clients are provided support services within designated TSHC units by partner agencies. So this represents around 529 units across 33 buildings. In terms of our activities completed over the first quarter, community services coordinators have completed our common amenities and program surveys to establish an inventory of our available spaces and current programs. The majority of our use of space agreement renewals have been completed, with 15 agreements pending. We also have completed tenant consultations for our use of space and tenant action fund policy development. Looking forward to our current work, we are currently coordinating tenant consultations for the new tenant engagement model that is under development. We're planning annual building meetings, supporting spring and summer community events funded through the Tenant Action Fund, along with supporting the coordination of municipal elections within our portfolio. Our goal for the remainder of the year, some of our goals for the remainder of the year are to implement a community needs survey, increase program and partnerships that align with tenant needs, including regional health and service alignment, and start to evaluate existing programs through tenant engagement. So the following graph represents a breakdown of our reoccurring programs across our 4 regions. The blue bars represent agency-led programs, while the orange bars represent tenant-led programs. So we currently have 45 agency partners offering 107 programs across 46 buildings and 19 tenant-led activities across 13 buildings. So in terms of the type of programming, the majority of our programming currently is represented by social recreation programs at 43%, health and wellness programs at 38%, and then food security, personal development, and faith-based programs for a total of 126 programs across our portfolio. Our common rooms are also utilized for one-time use of space activities, for example, training, health promotion activities, and private use by tenants for various events, including birthday parties and family gatherings. These represent 33 one-time community events across 13 buildings and 27 private events across 17 buildings over the first quarter of this year. So in terms of our partnership agreements in the pipeline, we've completed 36 use of space renewals over the first quarter, with 15 agreements in process. And we currently have 45 agency partners operating within our buildings, with the majority being community service organizations, followed by health, food security, and faith-based organizations. We've provided a breakdown of specific agencies by type in the following slides for your reference. So I'm just going to skip over these. These are more for the committee's reference. So moving on to our health and social service partnerships. I would like to provide a brief overview of our current health and social support partnerships with a focus on the first 3 partnerships that cover the Northeast and Northwest regions, which our tenant rep Bill Lohman referred to. I want to highlight these particular partnerships because they will serve as a model for future regional health and social alignment. These 3 partnerships include the North Toronto Neighborhood Care Team, Baycrest Wellness Clinics, and the Connected Communities Program. These collaborative initiatives are working across agencies to support the individual health and community well-being of tenants within their respective buildings. So just taking a closer look at the North Toronto Neighborhood Care Team. The North Toronto Neighborhood Care Team is operating out of 71 Merton, offering community development activities, access to a physician, clinical support services, and regular coordination meetings to offer these on-site supports and services for tenants at 71 Merton. And this is being done through a collaboration of 8 health and community support agencies that are affiliated with the North Toronto Ontario Health Team. And they're working in conjunction with our senior services coordinators and tenant representatives to coordinate programming and to develop ongoing initiatives. They're looking to expand services to other TSHC buildings within the catchment area over the coming year. So the second partnership that I want to focus on is the Baycrest Wellness Clinics. Baycrest Hospital has partnered with TSHC to establish 4 on-site wellness clinics through extensive tenant engagement and collaborative planning to offer tenants access to on-site health and social supports in conjunction with nurse practitioners, social workers, care coordinators, our senior services coordinators, and tenant representatives. They will be establishing these 4 clinics over the course of the year, and they're also looking to expand services to other buildings. So lastly, in terms of the programs in North Toronto, I want to highlight the Connected Communities Program. The Canadian Red Cross, Health Commons, and affiliated partners have been piloting the Connected Communities Program at 3174 Bathurst in collaboration with the tenant community, tenant representatives, and senior services coordinator to identify tenants' programming needs, to develop a community programming calendar, develop a peer support network, and host a regular roundtable for tenant representatives, site staff, support service providers, and community agencies to plan and coordinate programs and services. So we're really looking at these three initiatives to serve as models for health and social service alignment across the other regions. And they're in some ways a step ahead of the other regions. And there's a great opportunity for us to learn from these initiatives as well as collaborate in their expansion. So I just want to touch upon a few other initiatives just to bring to your attention. In terms of the Southeast region, we've been working with the primary and community care response team. And the primary community care response team is a health and social services collaborative in East Toronto operating for 2 years, covering a geographical catchment that covers 19 TSHC buildings. Senior services coordinators have the opportunity to refer tenants with presenting health and social support needs and collaborate with other service providers to support tenants as needed. In terms of the Toronto Public Library, they are in their second year working with us in a very valuable partnership. Their community librarians work within 8 of our buildings, and they're offering tenant engagement, digital literacy, basic classes, and community librarian supports that will continue over the coming year, and they will adopt another 8 buildings over the next year. And they've committed to providing permanent community librarian services across the portfolio for the years ahead. In terms of the Fort York Food Bank, the Fort York Food Bank at 91 Augusta is representative of some of our current food security partnerships. They've been operating since January 2021 to offer nutritious, fresh, and culturally appropriate food packages to 180 tenants with a focus on tenants who are homebound or dealing with mobility challenges. They're in the process of applying for ongoing funding, and we look forward to our continued partnership. And lastly, the Alzheimer's Society is piloting an initiative to offer tenants in 2 TSHC buildings with free on-site cognitive assessments to assess memory loss and help access care sooner, with the goal of offering this service more broadly over the coming year. There is one other partnership that I do want to just touch upon, which I missed, and that is the NORC Ambassadors Program. So the Naturally Occurring Retirement Communities Innovation Center, NORC for short, the NORC Innovation Center has partnered with TSHC to offer their NORC Ambassadors Program in 2 of our buildings over the past year, and is currently expanding to buildings in the Southwest region. The NORC Ambassadors Program works with tenant communities to identify individual tenants who want to work together and supports them to develop a peer model to identify a building's community development needs and support the community to align community programs along with health and social services to meet the needs of the building community. So just to wrap up here, TSHC's foundation of stable housing is a strong social determinant for tenant well-being and security that through our programs, partnerships, and tenant engagement activities is being employed to address the challenges of poverty, aging, isolation, and communication barriers faced by TSHC's tenant population. Looking ahead, we want to work together to impact positive change for our communities, plan and deliver place-based supports, develop processes and practice designed to be scalable, efficiently and cost-effectively align resources to tenant needs in geographies with significant use of publicly funded services, and integrate services to enable more seamless transitions between housing and healthcare. And that's it for my presentation. Thank you. Any questions?
Thanks, Jaypreet. Questions? Fareed?
Yeah, thanks, and thanks for the presentation. I think it was very informative, and looks like you have your hands full with the number of partnerships that are in play. I just had a question. I'm trying to make a distinction between the tenant-led programs and the partner agency-led program, and was wondering, obviously, these programs are based on capacity to deliver. But is there a particular type of programs that are more inclined to be tenant-led as opposed to agency-led? And then the second part of the question is there a push or request for us to have more tenant-led program, and how can we provide them with the capacity to be able to improve their representation in the number of programs that they offer?
Thanks, Fareed. So in terms of the type of tenant-led programs, we do see tenants proposing social recreation programming. So predominantly, a games night or a community karaoke night, or a community dance, or a seasonal celebration. In terms of looking at empowering tenants to take more leadership around implementing community programming, we are our use of space policy is currently under development. Our permanent use of space policy. We're hoping that that policy, along with our tenant action funding policy, will be streamlined and simplified to be able to allow tenants to be able to easily propose ideas, get funding for ideas, and then implement them across the portfolio. With the addition of our community services coordinators, we have additional support as well to provide some guidance in terms of implementation. We are looking for tenants to take ownership and rely on their tenant communities to implement these programs, but we are there to lend a helping hand for those communities that are just getting up and running. As you can see, a little more than half of the portfolio has programming at this time. Our goal is to empower the other communities to also consider their programming needs and align programming to meet those needs.
Thanks, Japreet. And I know that I should comment that we wanted to actually put a bit of a shine on the partnerships at this meeting, because we haven't spoken a lot about them, but I think it's actually a really fair question. And I think, thank you for answering. And I'm going to pass it over to Lawrence, whose hand is up, and then Brenda.
Through the chair, what services would Green and Loft provide?
So Wood Green and Loft are providing Loft, for example. Firstly, they're providing on-site support services to tenants that meet their criteria within a number of our buildings. They're also offering some community and social recreation programming. Wood Green has been a valued partner for a number of years. They have personal support worker programs in a number of our buildings. They also run seniors active living programming within the community, and we're working with Wood Green moving forward to better align their seniors centered programming to meet the needs of our community members.
Thank you.
Thank you. Brenda?
Just a couple questions. In terms of accountability, I mean, we have these partnerships, people use our space, and I'm concerned about the accountability piece. How are we certain they're doing what they say they're doing? Because that's been part of the concern. And how do we get some sort of at least annual check-in to see, are you doing what you said you're doing? Are you suitable? Are you engaging with our tenants in the manner that we want you to engage? So if you could just speak to that accountability piece.
Yeah, and maybe I'll let Tom jump in. I think did you want to jump in or no?
Yes, I did have a response with Japreet. If you want to start, then I can add anything in, because I just know this is a space that we have been working on to improve.
Right. Thank you, Brenda. So in terms of our capacity to evaluate programs, we are moving forward So we had interim agreements in place. Moving forward, our agreements have annual evaluation criteria and annual reporting criteria. We're also working on implementing attendance, so to be able to collect attendance online and do periodic checks with our site staff to make sure the numbers align with the people attending. And then lastly, our goal is to do annual program evaluations through participant surveys to make sure that tenants are actually satisfied with the programming that they're receiving, and there's sufficient number of tenants attending those programs. We're also in the process of implementing a tenant community needs survey, and that will give us a more broad perspective on the types of programs that tenants want for better alignment, and then also their satisfaction with existing programs.
Because it seems to me that's the missing piece in terms of fine tuning things. The problem with renewals and ongoing relationships is they often, you kind of slide into everyone accepting things the way they are, you know, and I mean, I used to work at Wood Green, so I know the work they do, but because they're so big and they're so dominant in the field, you know, are we happy with what they're doing in other ones as well? And do we have the capacity, and I guess this is the staff capacity question, to really examine this? Because to me, tenant-led is not just, you know, whether they run it or whether it's their direct suggestion. I mean, I'm certain there's not a whole lot of people who will individually say, I'd like to have our EMS service at our building. They'll say a generalized need for health and professional people being located there. But I just think that there's a certain staticness. You know, I like to see something shook up a little bit here and a little more creative. And there is certainly a role for just program planning, you know, from 2 to 3 we'll have exercise, and from 3 to 4 we'll, you know, we need those basic things. But I think I'm asking, I guess it's a broader question, which maybe you cannot answer right now. I understand that. But the broader question of what are we attempting to do here? And it seems to me the 2 goals that I would say predominate is obviously meeting people's needs, but also creating a sense of community and community development, so that this is your community, this is your home. And how best can these activities be supportive of what people would do in their own communities, in their own homes, in their own neighborhoods? And so that's a qualitative measure, which is sometimes hard to capture. I understand that. But I just want to raise that concern that I just don't want it to be getting on to get on and same old, same old. I think we have a very unique opportunity of space and time and commitment. How best can we generate something innovative here? And I worry because sometimes we get caught up with these interagency partnerships and the round of meetings and, you know, the hours it takes to get Baycrest to do such and such, when really what people want is increased housekeeping services, increased PSW services at their home.
Yeah.
Okay. They don't want to have to spend time in meetings with Baycrest. If Baycrest wants to deliver it, that's fine. But I'm struck by, I don't want to get bogged down with these larger interagency partnerships that can suck the energy out of staff and tenants, and doesn't deal with the basic issue of services and quality of life.
Thanks, Brenda. So if we look at our journey since June 1st, our initial effort to date has been to renew our existing programs. We have been relying on some community engagement to identify tenant needs, and also some legacy data to align our programs to those needs. Moving forward, we're committed to better identifying those needs to align programs. And to your point of the capacity and complexity in developing and evaluating partnerships, I think the development of the Ontario Health teams, as well as our close relationship with senior services and long-term care, is going to go a long way in terms of us developing strong regional partnerships of quality service providers. They've already proven their services within the field. We know that tenants are happy. We're also giving an opportunity to pilot initiatives and get feedback from tenants, and then and have annual check-ins with both the tenants as well as the agencies. That's the goal. There is some limitations around staff capacity, and we are hoping that technology can bridge some of that capacity gap. So those are the tools in the short term that we're thinking of, and we hope to be more innovative and aligned to regional needs, over the long term.
Thanks, Jaypreet. Tom, did you want to add to that, and then Carrie?
I would just at a kind of, I guess, a bit of a higher level, and I'm not gonna. This was, Arlene's in starting kind of her work as the director in this area, kind of coined, what is the value proposition, right, that we bring to the community provider, and it really helps to frame the discussion, for example, with the larger groups such as Bakers, or we've continued to talk to Wood Green more about expansion. So we have 15,000 seniors in the community in our buildings. We have certain spaces in the buildings, and we can determine if they that part of the value is that if they do engagement with our tenants, they'll find out what they want, and so we've been putting together this what I'll call it, this value proposition around what do we have, what is our need, what can we offer, what can they offer to us, and a part of that, and I think it's really good that the board is raising it, is that aspect around kind of evaluation. And I saw that going around from the building, someone like Lofted may be really successful in one building, but it needs a bit of TLC in another, right? So having more kind of formal agreements and that accountability in place is necessary as we build this out.
Thanks, Tom. Carrie?
Thank you, Jaypreet. Just a tremendous amount of work that you've done. Congratulations on everything you've been able to accomplish. It's phenomenal. I think Tom used that word earlier on when he was introducing you. You've sort of answered my question in part of your explanation to Brenda, because in reading your presentation, I was struck by the number of times that you said, we're focused on alignment, and we've spent the last year aligning, but we haven't had all of the tenant input, to align to our programs. We've got the tenant community needs survey is down the pipe. It's coming. So I was starting to be a little concerned that we were aligning an awful lot to old information, and you acknowledge that we are using some legacy information to sort of bridge the gap. And I just want to hear it once more, like your intent going forward is really to use this newer information that you're gaining each time you meet with tenants, and then through the community needs survey to truly align what tenants are asking for with the appropriate providers.
Yeah, and that's exactly right, Carrie. And also relying on our current tenant reps, we are working very closely with our current tenant reps in terms of our existing partners. I think Bill Lohman had mentioned, how well him and Olga are engaged with the Red Cross and the support providers within their building. We're also looking at fresh data, like from agencies like Baycrest. So Baycrest and their allied partners made the effort of going door to door in the buildings that they're setting up the neighborhood care team in, as well as the wellness clinics, to survey tenants individually and identify their needs. So there's an opportunity there for us to work collaboratively. They're sharing that information for us to better align programming to the needs that tenants have identified, right? And then they're also enhancing partnerships accordingly. So yes, we are committed to using current information to make those partnerships better aligned to meet the needs of our communities.
Thank you.
Great, thanks, Jaypreet. Last comment to Brenda.
Resource question. How many staff are we talking about here? I noticed in your chart there's 4 people, 2 clerks, yourself. Are other staff, either the seniors coordinators, are they involved with partnership development and maintenance, or is it just coming from your guys, your office?
No, so Brenda, this is a real collaboration between the operations team and our small team. So we have the senior services coordinators on site in each of the buildings. We have site staff that have been immensely supportive of our population health initiatives. Our current complement are of 4 community engagement coordinators. They've been focusing on identifying spaces, renewing partnership agreements, and now they're also reaching out to like a citywide committees such as there's cluster tables to identify new partners and agencies to see if their services align to tenants' needs. They're going to be involved in the new tenant engagement model consultations as well as the rollout. So it is really, from my perspective, it's an agency-wide initiative. It's not dependent on our tiny, small team. We're all collaborating together to improve the lives of seniors within our buildings.
And just a little information, I mentioned St. Matthew Brackendale. My sister lives there, and how that's a model in many ways of these sorts of things. Baycrest, an individual friend of mine, this is not a partnership arrangement, but in terms of the quality of the agency services, Baycrest, there's seniors, whatever they call the team, and she's considered high risk because of her age and health. They came to her apartment, right? And doing the assessments and talking with her, and they're doing all the follow-up, which usually I'm the one stuck with that. So that's why I'm quite impressed by this. And indeed even had a small fund to help purchase some adaptive equipment for the home. So that's what I mean by quality partnerships, that's exactly the engagement sensitivity, the senior model that we want to see. And I was quite impressed just with my little, experience there. And that's not with a formal partnership. So it just shows what we could do with more engaged and more focused connecting and partnerships.
No, exactly, Brenda. And like an agency like Baycrest is also making that extra effort to identify allied partners. And then bring in those services and take the lead in terms of coordinating the health and social supports, right? They're the experts. And I think that's really a model that we can leverage, right? And we can deploy across the other regions.
Thank you.
Thank you. Thank you very much. And to get that testimonial from Brenda is very important. I have to say, as I was sitting, listening to this, it was such a confirmation of the benefits of actually Toronto Seniors Community Housing, that actually the benefit of actually having that seniors focus. Let's remind ourselves, these buildings existed before this corporation. The tenants seniors were living in these buildings before. There was many partnerships, and the diligence that you're actually putting, and I feel like the alignment with the resources that are available for people, that we're not reinventing the wheel, and in terms of actually creating the services, but actually the nuance of and the importance of those partnerships and the accountability. I'm feeling very encouraged. I think this is just the beginning. And like I said, this is a focus more on the partnerships, the formal partnerships, and we will continue the tenant engagement work that Bill actually referenced. But I think that this is great, and we'll be really interested in actually getting feedback on the reports from our tenants on how are these partnerships benefiting their quality of life and the quality of the community. So thank you so much for bringing this forward and for highlighting some of the partnerships. We want to see more of this. It's great. Thank you. And I see lots of support from the folks around the table.
Thank you.
And you're welcome back anytime. So our last item before we get to the our additional meeting is our report, our quarterly report from OACH. And we have Melanie Martin here, who provided the presentation. Do you want us to put the slides up, Melanie?
I don't need them. I just have a quick summary. I'm just going to go through the main points. So I think I'm okay just to give a short presentation, if that's okay. I don't know if you want to put the whole report up. It's quite long.
That's perfect. Hopefully, I'm assuming that everyone has read it, and we really appreciate the depth of the report. So go ahead, Melanie.
Okay, so thank you. So through the chair, I'll just go over and summarize the findings and recommendations for the first quarter. So during this period, the OACH received 60 referrals and we closed 38 cases. So we audited these files using the same theme-based audit categories that we used in our previous reports, which are in the appendix 1 of this report. So the audit of our files indicates that the new arrears collection process appears to be working and that the arrears are being detected and acted upon sooner. So in comparing only the newer files with arrears of rent, which were sent to our office in this period, the average amount of arrears at time of referral, has decreased, as well as the average month of referral to the OACH after the arrears started accumulating. So this is great news, and it seems to be going on quarter after quarter. So as with the last period, the only significant finding from the audit was the need to send the N4 within the timelines of the arrears collection process and to make direct contact with the tenant in the first month of the arrears. That being said, again, the TSHC has shown improvements in this area over the past 3 reporting periods. So once again, we had no findings in the category of non-compliance with policies or procedures or in the category of unreliable information. We also reviewed and received 20 referrals in this period where the tenant had breached an OACH brokered repayment agreement. So within these referrals, we note that the OACH brokered repayment agreement was breached on average in the 3rd or 4th month. However, it was not referred back to the OACH on average until the 10th month. So this indicates a need to ensure better tracking of OACH brokered repayment agreements. So this is important because if staff speak to the tenant in the first month of a missed arrears repayment, the tenant may be able to catch up more quickly. And following that, if a referral is made to the OACH in the 2nd month of a breach repayment agreement, we will be able to address the breach quickly as well by determining whether there's exceptional circumstances or not and help the tenant get back on track. So if these measures are taken early in the life of the repayment agreement, there is a greater likelihood of preventing the eviction and preventing the arrears from accumulating further than they need to. So lastly, in this reporting period, we recovered approximately $101,000 in arrears by brokering repayment agreements, accessing funds through the Housing Stabilization Fund, direct payments from tenants or families, and by reversing losses of subsidies or submitting documents to support an annual review. So that's a basic overview and summary of our findings for the first quarter with the most important audit findings. And I'm happy to answer any questions that the committee may have. Thank you.
Thanks, Melanie. Any questions, comments? Maybe I'll ask the same question that, go ahead, Brenda.
Just interesting point. So you had 60 referrals to OACH?
Yes, in this quarter, yep.
Well, that's kind of phenomenal when you think that there's what, 15,000 tenants. So we must be doing something right if we only have, I mean, every case is unique and special, but it's, you know, I'm quite congratulatory that it's just 60. So we're improving systems sufficiently probably that we're catching people earlier. And I think that's a really wise thing because people get discouraged when they're too much in arrears. I mean, it's just, you just give up, you know. So I think the earlier the better, and I applaud you on that. So just a comment.
Thanks, Brenda. And my experience, having had a little experience with OACH over the years, is actually the key to that early identification is actually our staff relationships and, you know, getting and tenant knowledge of OACH. I have to ask Melody, are you finding that that's working well, or anything that we can be doing to actually bring cases and issues ahead or be more proactive?
Thanks, through the chair. So I have to say, I have a great working relationship. I'm meeting regularly with senior management with TSHC, and we're working on tools to make it even better. So I've been working closely with Brad and his team, and we're creating this live document. So we're actually going to be able to, I can send my recommendations back. It can be identified by staff, by region, to identify issues that way. Also, we're hoping this will resolve the issue with the repayment agreements, so they will get caught sooner rather than just a system telling it. This is like a live spreadsheet. So I just anticipate things to keep getting better because from my view, the arrears collection process that the Seniors Corporation has implemented really seems to be working along with the staffing model with the SSC and the way the staff are organized. So
that's great. That's really really encouraging. I know that makes a big difference. And, you know, it goes without saying that sometimes having an auditing function and an arm's length function in an organization, it doesn't always, work in a trustworthy manner. And I'm really heartened by our staff and your willingness to actually really see the benefits of OACH to our tenants. And that's probably what's happening, Brenda, with the 60. I agree.
Yeah, no, and it speaks to, it's always the devil's in the details, isn't it? Like, who is the person that identifies someone's behind on the, like often, sometimes that's where it all falls apart, but that level of fine detail is often important to success.
Yeah, and I was encouraged actually, even in the report from the operational dashboard, in terms of the administrative requests, things like helping people with their taxes and helping people with their documents is actually, for me, is a precursor to having less people getting into arrears and actually accessing income that is available to them. So that to me is actually something we should pay attention to. So thank you for that great presentation, and you do a very nice description as well. Thank you for the detailed report in advance. Is there any other questions or comments for Melanie? Great, thank you very much. And I think that is also an item for information. So we're at our last item, and Grant, we were just going to talk about the next potential meeting, right?
Yes, thank you. Thank you, Linda. So through the chair, as we had talked about when we brought forward the work plan for QTE, and as Linda noted at the beginning of today's meeting, we had anticipated that we may need an additional meeting this year, given the schedule and as it had been outlined. And turns out that is something we are recommending the committee consider. So with some of the examples of items that would come forward to a meeting, and we're looking at a meeting to be in July, and I'll talk about the potential timing in a sec. We would be bringing forward some items around the tenant engagement model that we've talked about earlier in this meeting, the tenant experience survey that Tom referenced earlier in this meeting, some of the policy work on the use of space and/or tenant action funds that were mentioned in different spots in today's meeting, and also potentially some follow-up on the QIPs as well. There's enough there that will sufficiently, I think, fulfill allowing for some discussion at QTE for those particular initiatives to get the feedback and input from this committee as they move forward in a timely manner. Because our next meeting is scheduled in September at this stage, which seems, it feels quite a far away still, although it's not that far. But having a meeting in July, I think, would help fill a potential gap and would really, I think, help us as move these items along. We are looking right now, we have potential times in the second week of July on the 10th and the 12th. We could circulate those times out to the members to see if which ones would work potentially the best. We have looked to also align and be aware of city council and other things that are happening the following week so that we have a reasonable time frame to hold that meeting. So I would like to bring that forward for approval today. To add a meeting to the calendar for QTE for July.
Is everyone in agreement with that? If I could have a mover for that. And maybe we can confirm the date afterwards. Jim, seconder.
Carrie.
Carrie, thank you. All in favor? Yeah, and I agree. I think, Brenda, I think about some of your points early on that we need to have enough meetings to actually further this meeting, this work forward. So thank you, Grant. I think we've got the agreement, and maybe we'll just actually circle back to people to see if we have enough people to attend the July date that is suggested.
Yeah, so there's two dates, the 10th and the 12th of July that we flagged, and we're thinking July 10th is the preference, but we'll put those out there and get feedback for availability.
Great. So if you can check your calendars and let us know, that would be great. Thanks, Grant, and thank you to Grant for helping to put together, and Brad for putting together today's agenda and supporting the chair. I always appreciate it. It takes a village. And are there any other items that anybody has?
Just a technical question. Is it possible to have one of those like calendar surveys? When you ask us for meeting times, is this date better than this date? I find it's just useful when you have that system and you just indicate which one you prefer, so you as staff can see where the majority lies. And then you don't have to go back and forth with these endless all-in emails. Just a suggestion.
Great idea. Thanks, Brenda. So we'll work on that, but we will nonetheless, we will find a date in hopefully in July for us to actually address the issues that have come up, and we'll look at the technology to support that. Yeah, that's great. All right. So at this point, are there any other agenda items? Well, hearing none, I'm kind of glad that our next meeting is in September, because I just felt like the whole summer flashed when somebody said, you know, September is not that far off. It's like, okay, it's just May and it's sunny for the first time, and I just don't want to actually lose all these wonderful months.
I'm with you, Linda. I'm with you.
Yeah, it's like I'm going to savor every minute. So again, I want to thank everybody, and I want to thank all the members from the public. I hope that there's a big viewing audience today. Thank Bill for joining us for his deputations, and I wish everyone a and I'll just ask for an adjournment. Anybody move the adjournment?
So moved, Madam Chair.
All right, and Jim has seconded. All in favor? We're free to go. Have a great evening.
Have a nice evening. Good job, Linda. Thank you,
Yes,
everyone.
great job.